Greetings everyone, this is Dr. Abhishek Samdesi, and today we will be talking about ABG Simplified Part 6, which is regarding the clinical manifestation and interpretation of metabolic alkalosis. The clinical manifestation of metabolic alkalosis are mainly because of electrolyte imbalance. As we saw in the previous video, the main electrolyte imbalance associated with metabolic alkalosis is hypochloremia as well as hypokalemia. So which systems are mainly involved? They are the CNS, the CVS, the RS, as well as other system including the muscles and the kidneys. So let us discuss regarding each of the clinical manifestation. Talking about the CNS manifestation, the most common symptoms that the patient develops are increased neuroexcitability resulting in paresthesia. They complain of headache as well as corpopedal spasm. The CVS manifestations in metabolic alkalosis are hypotension and cardiac arrhythmias. The cardiac arrhythmias can be correlated with hypokalemia. The next manifestation is the RS, the respiratory system. So what happens with the respiratory system? The way to compensate for alkalosis is by hypoventilation. If acidosis is there, patient will hyperventilate to flush out the carbon dioxide. Here, when patient has alkalosis, what the patient tries to do is they go for hypoventilation so that excessive carbon dioxide is not flushed out and the carbon dioxide is retained. This compensatory hypoventilation in a normal person doesn't have any implication. But if the patient has pre-existing lung disease, the compensatory hypoventilation can result in hypoxemia as well as hypercapnia. The other manifestation of metabolic alkalosis are muscle weakness and polyuria. So these are the clinical manifestation of metabolic alkalosis. Now, how to interpret a metabolic alkalosis? So again, I'll be telling a simpler way. Whenever given an ABG, do not panic. Always write down the normal value and put an arrow if it is increased towards upward arrow or a downward arrow to signify it as decreased. That makes things easier. As discussed in my previous video, metabolic component, all the arrows are in the same direction. Whereas if it is the respiratory component, the pH and the PCO2 will be in different opposite directions. The metabolic component is determined by your bicarbonate, whereas your respiratory component is determined by your PCO2. Now let us talk about metabolic alkalosis. So this is the first scenario. So in this particular scenario, what we see is a pH is within the normal limit. The pH is within 7.4 to 7.45. But as we see here, the bicarbonate is elevated, whereas the carbon dioxide is normal. What this signifies is this is an acute event because the pH is still within the normal range and the carbon dioxide has not yet responded or reacted. This implies it is an acute event. That compensation is not yet begun. Let us see the second scenario. In the second scenario, what we see here is the pH is more than 7.45. So we put an upward arrow. Talking about the bicarbonate, even the bicarbonate is on the higher level. So that is why the pH is more than 7.45. When you look at the carbon dioxide here, it is still within the normal limit. So what it means is the carbon dioxide has not yet started acting, but the severity of increase in bicarbonate is quite significant to throw the pH out of its normal limit. So this is suggestive of uncompensated metabolic alkalosis. Let us have a look at the third scenario. Now we see that the pH is more than 7.45. The HCO3, the bicarbonate also is elevated and the carbon dioxide also is elevated. Now it means that the carbon dioxide is compensating for the alkalosis. So here it is trying to go for respiratory acidosis to compensate the metabolic alkalosis. But what we see from this equation is the pH is not yet come to the normal limit. So it is partially compensated. Now looking at the other scenario. Here we see that the pH is within the range of 7.40 to 7.45. So it is normal. That is why I put it in green color. Whereas the bicarbonate is elevated and carbon dioxide also is elevated. What this tells is that the carbon dioxide is elevated to negate the metabolic alkalosis and bring the pH back to the normal limits. So this implies that we are dealing with a fully compensated metabolic alkalosis. This is a simpler way to interpret metabolic alkalosis. These are the references. In the next video, we shall discuss regarding the respiratory acidosis. Thank you.